Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to go over a sciatica evaluation and treatment. I'm going to show you what it looks like in our office, and I'm going to show you some exercises and stretches that you can do at home to help relieve sciatica. When someone's dealing with sciatica, typically what they present with is they'll have back pain, and then that pain will be radiating down the back of their leg, down into their calf, and possibly their foot. So what we're going to typically do, we're going to start off as a more global approach. We're going to look at their overall range of motion, and then we're going to get real specific and check out that sciatic nerve all the way down to their feet. So what we're going to do is, the first thing we're going to do, we're going to put our feet together, and I want you to bend forward and touch your toes and stop when you have any kind of pain or discomfort. Good, come back up. Sometimes in sciatica cases, they'll have pain as they're bending forward. So it may be about 45 degrees or maybe 60 degrees, and we want to just kind of gauge that to see where they have the pain. So the next motion I want you to do, put your arms overhead and then bend back as far as you feel comfortable. Good, and relax. And again, we're looking to see, do they have any pain in that motion and at what point that occurs. So now I want you to put your feet together and I want you to rotate to the right as far as you feel comfortable. Good, and then let's have you go to the left side. Perfect, and relax. And what we're looking for there is we're looking for any asymmetry between both sides and if they have any pain. So from that point, we're going to get a general idea of how the range of motion is and where they're having pain or discomfort. So next what we're going to do, we're going to do more specific orthopedic tests to help kind of tease out and see where the sciatic nerve is getting irritated. So if this patient presented with sciatica down her right leg, we're going to do a test called the straight leg raise. And what we're trying to do is we're trying to pull on that sciatic nerve to see at what point it starts to get irritated, and then we're going to see at what point we kind of relieve the pain and discomfort. So what I'm going to do is let your leg relax. I'm going to move it for you. So we're going to raise it up, and we're just going to see how tight she is and at what point she feels pain. So a lot of times, so she's starting to tighten up right about there. Now a lot of times I'll get a patient to about here, and then they'll say they feel that sciatic nerve irritated either in their glute or down their leg. So at this point, what I'm going to do is I'm going to dorsiflex her foot. That's going to make a bigger stretch in the nerve and see if that causes more pain or discomfort. And then it usually does. And then what I'm going to do is I'm going to relax it down a little bit and then do the same test to see if that increases it or not. And if it does or not, we'll kind of mark that as a finding. And that's one of the ways we're going to kind of just check the nerve along that whole pathway. So we're going to start in the low back, go through the glute, down the leg, and see where it's irritated. So the next test we're going to do for a disc or sciatica injury is we're going to do a slump test. So what I want you to do is I want you to slump your whole body, and then I want you to drop your head forward. Good. And then I want you to straighten both legs. And with nerve or sciatica cases, what this is going to do is going to be pulling on the nerve all the way up from her neck, all the way down through her legs, and then she's bringing her foot up like that. You can relax there. And with sciatica cases, that's going to make the pain a lot worse. So what we're going to do is we're going to see if that creates the pain and discomfort and replicates it. So that's called a slump test. Next test I want you to do, you're going to have to face this back wall, so turn your body. And this time what I want you to do is you're going to grab onto the side of the table, or you can do this in a chair. And what we're going to do is I'm going to have you grab the table and try to pull down. And what we're doing is we're kind of bearing down and forcing some pressure on that sciatic nerve in the low back. And so again, if this increases her symptoms, it's a sign that you were dealing with sciatica or a disc injury. So the next part of the evaluation is I'm going to check out the joints in her lower back. We're going to check out the muscles around that tissue. And then if we're checking out her right leg, say she has sciatica down the right leg, we're going to check where that nerve goes through the piriformis, through the hamstrings. So at the knee, it's going to branch off into two different nerves, and we're going to check out there. We're going to check to see, is the muscle tone tighter on one side or the other? A lot of times when you're dealing with a sciatica or a disc injury, what you'll notice is this hamstring compared to the other hamstring will be a lot tighter. And it's not just that the muscle is tight, it's more of a fact that the nerve is causing the muscles to tense up. So all the stretching in the world is not going to make that hamstring feel better because it's more of a nerve issue coming from her back. So what I'm going to do is I'm going to assess her joints in her lower back and just seeing how they're moving. Good, and then we're going to apply some overpressure right where that nerve comes. And a lot of times patients will say there's some discomfort right in that area. Good. And now we're going to check out where the nerve goes right through her piriformis. And again, a lot of times we'll find that nerve and it'll be very sensitive for the patient. And again, just kind of palpating where that nerve travels. We're going to see how tight that area is. Good. And then again, just compare it with the other side. Good. And then we're going to go into the calf and gastroc area here. And again, a lot of times patients will have discomfort on one side of the calf or the side of the leg right through here. And again, we're just going to compare it with the other side. Okay, so the next part of the evaluation in this position is we're going to have her do what we call like a press up, okay? So what the idea with this is it will help to reposition the disc around the nerves, and it will centralize the pain, meaning it will cause the pain from going into the leg back up towards the central source, which is the low back. So we want to see if that changes anything. So what I'm going to have you do is I'm going to have you go onto your forearms like you're looking straight ahead. Good. There you go. And this would be the first position. She wants to keep her hips flat on the table. And what we're going to see is if this centralizes the pain or makes it feel better. And then from this position, what she can do is she can use her hands to push up from the table and to even go into more of an arch position. And trying to keep the hips on the table. There you go. And see if that changes any of the discomfort down the leg. For some cases, that's going to completely relieve a lot of the sciatica. And so we know for their treatment, we want to work on more extension type of exercises. And some people that actually will make it worse. And so we need to kind of adjust the treatment based on that. So that's the next kind of evaluation that we're going to do for sciatica. So once we've determined the patient is dealing with a sciatica or a nerve issue in their lower back that's radiating down the legs, the first thing we want to do is we want to get them out of pain. That's our first goal. Get them feeling better, get them moving better, and decrease their pain. So one of the ways in the office we do that is we use a treatment called laser therapy. And we apply that laser over the lower back and anywhere that nerve goes down the leg. So we're going to apply that laser in our lower back. I'll show you what that looks like. And basically what the patient feels is a very mild warm sensation, feels really comfortable. And what this is a powerful anti-inflammatory. It's going to penetrate deep around the nerve and help calm it down, and it accelerates the healing process for that nerve. So I'm going to show you what that looks like, and we'll demonstrate it on our lower back. To perform laser therapy for sciatica, we're going to select the sciatica protocol on the laser, and what we're going to do is we're going to place that probe about ½ an inch above the skin, and we're going to work a whole area in the low back where that nerve originates, and will help to calm the nerve down. What's great about this is it's non-invasive, and it's a way to really help get the patient out of pain and get them feeling better faster. We can do this as much or as little as we need to. A lot of times for acute cases, we'll do this from anywhere from 4 to 8 treatments, and for chronic cases, it'll be more like 8 to 12. But again, we're going to start off treating the low back because that's the source of the problem, and then we're going to go to the piriformis, the hamstring, and then the calf. Again, this is the most non-invasive treatment we can do for sciatica. Sometimes they'll do injections into that area, and then they'll also provide medication to try to calm the nerve down. But this is the most non-invasive way to help treat the nerve. The other thing you can do at home when you're dealing with sciatica is to place ice right across the lower back, kind of right where the belt line meets your low back there. And that's a great area to ice, and you want to ice it for about 15 minutes. Take it off for about 45 minutes to an hour. Let the skin get back to normal temperature, and then you want to reapply it again for another 15 minutes. You want to cycle that on and off as much as you can, and that will really help to calm down the nerve. So the protocol for sciatica takes about 6 minutes to do in the low back, and then we're going to progress down the leg to treat the nerve all the way down. One of the ways we can treat sciatica in the office is with a technique called dry needling. So with dry needling, what we do is we place a couple small acupuncture needles in the muscles in the low back. And we can place them in the low back, we can apply them in the piriformis, the hamstring, and the calf. And again, what we're trying to do is we're trying to relax that tissue around the nerve so it can calm down and take the pressure off of it. So what I'm going to do is I'm going to demonstrate what it looks like for the needles in the lower back. And then again, what we would do typically in the office is we would treat the glute, the hamstring, and the calf as well. Okay, so now we're going to apply the acupuncture needle to her lower back. And again, we're going to correlate with that same level where the nerve exits out through the spine, because that nerve also supplies the local muscles around this area. So by needling that local muscle that's supplied by the sciatic nerve, you can also cause the muscles to relax a little bit more. Okay, so now we have all the needles in her lower back to treat sciatica. And again, what we're trying to do with the needles is neurologically it causes the muscle to relax, which will help to calm down that nerve. And one thing we'll often do in the office as well is when we have the needles in the glute, the hamstring, and the calf, we can connect some electric muscle stimulation to that needle, and that just kind of works the whole circuit of that nerve to help relax that area. And that's a relaxing way to help take the pressure off the sciatic nerve. Now, we don't do this in all cases, it just depends on the situation, but this is one of the ways we can treat sciatica in the office. Another way we treat sciatica in the office is to do a spinal adjustment. So what we're going to do with this is we're going to place her on her side and we're going to do a couple gentle adjustments to help take the pressure off that joint and help to take the pressure off the sciatic nerve. What it's going to look like, we're going to place the patient in the side position. Good, just like that. We're going to bring you towards me. You're going to take a deep breath in, blow it all the way out. Good, there we go. And then let's have you face the other direction. We're going to do the same thing on this side. Good, and relax here. This arm goes right there. And then take a deep breath in, blow it all the way out. There we go, and relax right there. So a chiropractic adjustment is another way we treat sciatica in the office. The next way I'm going to show you how we treat sciatica in the office is going to be in the other room. We're going to perform spinal decompression for her lower back to, again, take the pressure off the disc and the nerve and to help that sciatic nerve heal. Another great way to treat sciatica is to use a spinal decompression table. So this table is designed to gently take the pressure off of the sciatic nerve in the lower back. And what it does is it stretches for 45 seconds and then relaxes for 30. We do that for about 15 to 20 minutes and it just decompresses the low back. It's like the opposite of sitting. It takes all that pressure off of the spine and gives that nerve some space to move around and take the pressure off. So what I'm going to do is I'm going to demonstrate what spinal decompression looks like. You won't really necessarily see a whole lot, but what's going to happen is underneath the table here, it's going to open up about 4 or 5 inches, and that's telling me we are getting a good distraction and taking the pressure off of the disc and the nerve. Okay, so now we have the spinal decompression table on, and what's happened is when it's in the stretch position, the table is opened up about 4 inches, and that tells me, again, at the nerve level, at the disc level, we're getting a good stretch. And again, just taking that pressure off of the nerve, allowing it to heal. And again, how would you describe what this feels like for your lower back?
Super relaxing. One of my favorite treatments.
Yeah, and it just, again, takes all that pressure. Think of it just like the opposite of sitting, and we do so much sitting. There's so much compression on that nerve. This feels really good when we're just taking the pressure off of it. So spinal decompression is another way that we treat sciatica in the office. One part of our sciatica treatment in the office is to give the patient exercises or stretches that they can do at home to help relieve that sciatic pain. So the first one I like to do is have the patient get into the right sleep position when they're dealing with sciatica. The best sleep position if you're dealing with sciatica is going to be on your back with your knees bent up. And what we like to do is we have a patient place a couple pillows underneath their knees at home. Lift your legs up for me there. Good. What it does is it flattens your lower back, opens up the space where the nerves come out, and it's just a good position to get in for relaxing that sciatic nerve. So this is going to be the best position if you're dealing with sciatica. So one exercise we give patients that are dealing with sciatica is called nerve flossing. So what we're going to do is you're going to be a seated position here. If we're dealing with sciatica down the right leg, what she's going to do is she's going to extend her right leg, and then she's going to bring her toes back towards her face. And then as she does that, she's going to tilt her head back. Good. And then now we're going to go the opposite way. We're going to bring your chin down and bring your leg down and then point your toe. Good. And now we're going to straighten the leg again and then bring your toes up towards your face and then extend back and then relax down. So what we're doing with this is we're basically pulling the sciatic nerve using the tension in our head along the way to the leg, and that's just going to help to relax that nerve and to get it gliding and moving better. Sometimes this will be a little bit uncomfortable initially, and then as you do more reps, it'll start to loosen up and you'll feel the nerve gliding a lot easier and the sciatica will feel better. That's one of the exercises we'll give patients if they're dealing with sciatica. It's called nerve flossing. The second exercise I give patients to do at home if they're dealing with sciatica is called the McKenzie Press Up. So what we want to do is we're going to have the patient start on her forearms, and she's just going to maintain that position just like that. Sometimes when you're dealing with an acute sciatica, that's as far as you can go, and that's fine. But we want to just start her in that position. And again, what we're looking for is we're looking for the pain to kind of centralize. So again, if the pain is shooting down the leg, as she's doing this exercise, we want it to feel like it's kind of going back towards the source of the problem, which is in her lower back. So this is the start position. So just in that kind of press up position. Then what we want to do is we want to actually extend back using our arms, and so we're going to push back into an extended position even more. And again, what that's doing, it's going to force this more into extension. And again, the idea is it's going to help take pressure off that sciatic nerve and to kind of help it centralize. And so she can relax down. And then we're going to do about 10 reps where we're pushing up and pushing down. The key is you want to make sure your hips are flat on the ground or on the bed, and that's going to help to make sure you're getting a good extension exercise right in the low back there. But this is called the McKenzie exercise, and it's really good for dealing with sciatica or disc cases. So if you're dealing with sciatica, give our office a call at 703-912-7822, or you can schedule online at novachirowellness.com.